This lecture will be on special imaging modalities, and you have some objectives that you need to be able to explain in key terms. So, looking at cardiovascular interventional radiography, first thing we'll cover is angiography. So, it's an invasive procedure that demonstrates vessels by use of contrast. We do cerebral angiograms, which demonstrate the vessels of the brain, an aortogram, which visualizes the aorta, arterial system, so general term for visualization of arteries, and venogram is the contrast study of the veins. So we'll study the arteries and we'll study the veins throughout the whole body. This is a cerebral angiogram. So as you can see here, you can see all the vessels within the brain, all the arteries. Interventional radiography refers to the repair of a vessel by means of specialized catheters in conjunction with angiography. So angiography is just the diagnosis, and interventional will actually go in and do repair. So percutaneous transluminal angioplasty is PTA. So we use a balloon to treat atherosclerosis, and sometimes we'll put stents in to hold that vessel open. Atherectomy is a mechanical device used to remove arthromas. Stenting is inserting to help maintain the patency of a vessel. So a lot of the stents are treated with drugs to keep it from clotting. So transcatheter embolization prevents hemorrhage and reduces blood flow or cuts off a blood supply to a designated area. And this is, they'll use this for uterine fibroids. Vein therapy. So treatment of a vein for problems such as occlusion, stenosis, varicose veins, or inflammation. We'll also do sclerotic therapy and radiofrequency ablations. Okay, looking at computed tomography. So CT. So the CT scanner consists of a movable table with remote control, so we can control it from our console typically. Circular gantry, it looks like a donut, structure that supports the X-ray tube and detectors, and they're at opposite sides, and it spins around the patient. So an operator console with a monitor and supporting computerized system to let us control the software, and the hardware and software to achieve and manage data and to produce both electronic and hard copies of images. So we use it for brain, spines, abdomen, pelvis, chest, necks, paranasal sinuses, orthopedic exams, contrast enhanced, vascular studies. We'll do angios, we'll do venograms. We do it for trauma imaging. We use CT for everything, biopsies, you name it. CT contrast examinations. So iodine medium is used. And we use it for the chest, the abdomen, larynx scans to delineate vasculature. When we do an angiogram, it's called a CTA. Oral barium is used with the abdomen and pelvic scans to define the GI tract and organs. Sometimes we'll have the patient take a mouthful and swallow it right when we're scanning if we're worried about esophageal cancers or strictures. So contrast enhanced CT, so looking at this image here, this is an axial slice, and that's how the scanner scans it. Here's your left kidney, your right kidney, here's your aorta, your celiac vein. This is a piece of your liver. This is your large bowel. The head of the pancreas looks like it's right here. This is all small bowel markings. So rectus abdominis muscle here. This is all fat all the way around. This darker is fat, the lighter is muscle. So this is the spine right here with the spinal cord. Oh, I did want to show you the white is the oral contrast. This right here, we have blushing of the kidneys and blushing of the aorta. So there's IV contrast on board also. Okay, CT myelogram, so enhances the information obtained with myelography by demonstrating the dural sac and the nerve roots in the transverse plane. So patient is brought to CT as soon as the routine myelogram is complete. So it's important to minimize delays between fluoroscopic procedures and the CT because the contrast agent is rapidly absorbed from the spinal fluid into the bloodstream. So it's really, really important that you get that patient into the scanner right away to scan them. And the scan is really quick, so we can usually squeeze them in between patients. will not be sufficient concentration for good visualization if too much time is lost. So, as you can see here, this is CT myelogram of the lumbar spine, and the white is the contrast, and you can see that it clearly shows us any impingement on the spinal nerves. MRI. A non-invasive diagnostic modality does not use ionizing radiation. It uses a combination of a powerful magnetic field and radio frequency pulses, produces a radio signal in the body that can be detected and processed electronically to provide images on a computer monitor. Now that's really dumbed down. Okay, there's a patient table, and it says a gantry. I don't call my MRI a gantry. CT has a gantry, MRI has a bore. So I don't like that it says gantry. So you'll always hear me correct this and say bore. So you can tell the difference between a CT tech and an MRI tech based off of what they call their machine. So if it's a gantry, it's a CT. If it's a bore, it's an MRI. So the bore houses the magnet. It's tubular. It's usually 5 to 8 feet long. Surrounds most of the patient during the exam. So the patient goes to the center. It's called isocenter for any exams that we're going to be doing. Open gantry accommodates larger claustrophobic patients. Typically, they're less powerful. And we have less, with that lower power, we don't have as good as image quality. Now they're making short, wide bore, high field magnets. So this is kind of old school. So modern technology, the new scanners are really wide and really short. So very, very nice scanners now. Most patients can handle those, even if they are claustrophobic. All right, so closed monitor combination with computer support. So we have RF coils, so they generate a radio frequency pulse electronically. It causes the loud noise or the hammering sounds typically seen in MRI. That's all normal. And looking here, this is a traditional MRI unit right here, and this is an open scanner here. So we use them for the brain, spinal cords, joints, breast, vasculature. We pretty much scan abdomens, pelvises. We scan everything in MRI now. So it's used just like CT, and it's getting fast. So we're able to do studies quickly in there. So this is the SAGT1 of the brain, and there's a big old gomer right here. So that's not good. Here's the maxillary sinus, the eyeball, and there's like a little lymph node right here, enlarged lymph node also. So this is a tumor. All right, MRI contrast medium, pharmacomagnetic. So we use gadolinium-based agents, and often abbreviated as GBCA. So gadolinium-based contrast agents provide contrast enhancement to delineate various lesions and to differentiate scar tissue from disc material in the spine. And the biggest risk is if there's kidney disease. So if there's kidney disease, then we have to worry about NSF. MR angiography, so used to detect, diagnose, and aid in treatment of heart disorders, stroke, and blood vessel disease. And we can run an MRA without contrast if a patient has problems with their kidney function. We like to run without and with. So here's the carotids. They're a little late on these carotids. See, it's good for up here, but you can see you have washout down here. So they're a little late on their go. MR spectroscopy. So it's a specialized MRI technique that scans the volume of the tissue to identify and measure the quantities of specific chemicals in the tissue. So chemicals and physiological information attained with MRS makes it particularly useful research tool for an investigation of the brain function. Typically, we don't run spectroscopy because it's not reimbursed. And we like to get paid. So MRI safety is a big deal. The magnetic field and or rapid RF gradients may be hazardous for patients, so we need to make sure they don't have heart valves, artificial heart valves, aneurysm clips, neurostimulators, middle ear prosthetics, IUDs of certain types. Particularly hazardous for patients with pacemakers. They must not enter the scan room. So this is kind of old school. So the newer train of thought is that there are MRI conditional pacemakers, and they are MRI conditional, which means that they can go in the magnetic field as long as the technologist pays attention to the particulars of what the company who made the device states. So a lot of the times they'll go and they'll put it in an MRI safe mode, and then we do the scan, and then afterwards they reprogram the patient into their normal rhythm. So there are facilities that scan MRI pacemaker or just pacemakers in the MRI that are not MRI conditional. Yeah, and the patients are fine, so I'm not sure. All right, so other conditions to be assessed before MRI. You want to look for hemolytic anemia, pins and screws. I don't really worry about pins and screws too much because they're pinned in there and they're screwed into the anatomy. I am concerned about metal fragments or shrapnel in the soft tissues, and pregnant patients. I want to know if they're pregnant. So the philosophy is to avoid MRI during the first trimester. No one should enter the scan room with loose metal objects. Hairpins, they will rip right out of your hair with the hair still in it and be in the magnet. Scissors, pins, watches. If you go in with your watch on, it will stop working. And if it's a digital watch, then you just need to replace your battery, and it'll work a few times going in and out of the scan room, but not long term. Wheelchairs or stretchers are not specifically designed for MRI, cannot go in the room, so you have to grab the ones that are. Steel O2 tanks, and even if they're MRI safe oxygen tanks, you need to make sure your regulator's safe also. So don't take your credit cards in. I've gone in with my credit card in my pocket a million times. I always had a second bank account. So if I walked in with my credit card in my pocket, because I go to lunch, and I just take my credit card, then I would use my other card, and I'd have to get a new credit card sent to me. My credit card company was like, what the heck? How come you're going through so many? So I got a huge wallet, and I put that in my pocket so I wouldn't go in the scan room with my credit cards. Neurostimulators are also not allowed within the scan room. Claustrophobic and pain management. So communicate exams specifics. So you want to tell the patients how long they're going to be in the bore, that it's going to be noisy, and very, very important that they hold still. So have complete, transparent communication with your patient. They're more inclined to get through the study and get it through quicker because you don't have to do repeats, okay? So maybe accompanied by a screened loved one for comfort. So there have been times where I've taken my tech aid and stuck them in there with them, or they brought a family member. So you screen them and put them in there with them so that they're okay. There's also medications that we can give to help with the anxiety. Ultrasound. So, also known as diagnostic medical sonography, it is a non-invasive procedure considered to be safe. It uses high-frequency sound waves to produce echoes within the body. The echoes return to the sending point of the transducer, so the transducer has these vibrating crystals that produce this sound wave. Okay? Their strength and time are interpreted by the computer to produce a map or graph image of the echo distribution. The transducer is moved over the surface of the body, and the image is viewed in real time on a computer monitor. So we use it for pretty much every part of the body. It's really good for gallbladders, hearts, pancreas, spleens, livers, breasts, reproductive, testiculars, and musculoskeletal. Here's an ultrasound of chronic pancreatitis, so you can see all the angry, mad pancreas. It shouldn't have air in it. Obstructical ultrasounds are the principle for fetal imaging. High-level safety compared to other procedures that involve X-ray. So there's a wide range of obstetrics. Information including gestational size and age, location, needle placement for amniocentesis, establishing presence of a living embryo at an early stage, evaluating fetal position, locating the placenta and the umbilical cord, checking the amount of amniotic fluid, and assessing the fetal growth and well-being. So here is a baby. You see its nose and its lips, and here's its little brain developing, its chest. And here is, this is 2D, this is normal ultrasound. 3D, this is the new cool thing. There's actually 4D out now, so you can see his fingers pointing at us and his little nose and mouth and the eyes. Very cute. All right, trauma applications. So FAST, focused assessment with sonography for trauma performed in the ED to screen for pericardial tamponade, hemoperitoneum, and examination for free fluid in the perihepatic space, perisplenic space, pericardium, and pelvis. Often reduces the need for CT, which is going to reduce patient dose and save time, which is really, really important. Doppler ultrasound is a form of sonography that can detect and measure the speed and direction of blood flow. So there's 3 types. There's color, pulse, and power. And you'll hear it as you walk by ultrasound, you hear push, push, push. That's the Doppler ultrasound. Echocardiography denotes ultrasound examination of the heart. A complete 2-dimensional study of the heart is made using color Doppler with pulsed and continuous wave Doppler with spectral tracings. So image cardiac anatomy in detail, including 4 chambers of the heart and the 4 valves of the heart. So useful in diagnosis of cardiac pathology such as atherosclerosis, endocarditis, valvular disease, and congenital heart conditions in neonates and young children. Specifically designed for use within the body. So there's endotracheal ultrasound, transesophageal ultrasound, transvaginal ultrasound, and transrectal ultrasound. So they'll stick a transducer in any hole that we have. Contrast-enhanced ultrasound. So contrast-enhanced ultrasound is the application of special ultrasound contrast media to traditional ultrasound imaging. The contrast is a gas-filled microbubbles, and it's ejected into the systemic circulation. These microbubbles have a high degree of echogenicity, so they reflect sound waves more than soft tissues, and this enhances image contrast. So, nuclear medicine refers to the medical use of radioactive isotopes, so radionuclides. They give off radiation in their attempt to reach stability. So radiation is measured by a gamma camera. Radiopharmaceuticals may be ingested, injected, or inhaled. It's unique in that nuclear medicine provides information about the function of the organs and tissues. So it's really important to note that nuclear medicine looks at the function. So here's a nuclear medicine bone scan right here. So you can see this is the mandible right here, and we have sternum, ribs, shoulder. Positron emission tomography, it's called PET, is a highly specialized nuke med technique. Similar to other nuke med methods, that is radioactive substance from within the body are detected and mapped by specialized equipment to obtain information about function of organs, tissues, and systems. So radioactivity level may be represented in colors on the monitor. So positron emission tomography is really big with staging patients for oncology. So here is PET of the brain, so you can see all the different colors, and it's based on the function and uptake of the tracer in which they gave. So single photon emission tomography, computed tomography, so it's called SPEC, is a nuke med modality that is similar to PET. It uses different radiopharmaceuticals that emit a single gamma photon instead of a pair that have longer decay time than those used in PET. SPEC images provide less sensitivity and less detail than PET. It's also less expensive and more accessible. So there you go. Fusion imaging. So it combines the function images of PET and SPEC with exceptional anatomical detail of CT or MRI. So common fusions are PET CT, PET MRI, and SPEC CT. So they'll take the nuclear medicine study and the CT or the MRI, and they'll fuse the two together, and it shows us anatomy really, really well. So looking at mammography, A radiographic procedure that uses specialized equipment to produce images of high contrast, high resolution for diagnosis of breast lesions. Facilities are accredited by the FDA and the ACR, with the American College of Radiology. Radiographers must pass a specialized ART exam in order to do mammography. So this is a CC view of the right breast. And ooh, they're kind of close. They've actually clipped some anatomy. So glandular tissue here, fat. Also, so as we get older, our glandular tissue is replaced by fat. So there you go. There's all your special imaging modalities. Make sure you read the chapter. It's got more information for you.